She'll say, hello. Katya, hello. Hello, Marco.
Hello, doctor.
Let us start, colleagues. Are we ready?
Yes, Professor.
Okay, I'll join my screen now. Can you see my screen?
Yes.
So today's topic will be devoted to eating disorders. Do you know what is eating disorder?
Like bulimia or anorexia.
Yes, correct. Just a few words about overview of the topic. Eating disorders are serious conditions related to persistent eating behaviors that negatively impact your health, your emotions, and your ability to function in important areas of life. The most common eating disorders are anorexia nervosa and bulimia nervosa. And of course, binge eating disorder. Most eating disorders involve focusing too much on your weight, body shape, and food, leading to dangerous eating behaviors. These behaviors can significantly impact your body's ability to get appropriate nutrition. Eating disorders can harm your heart, digestive system, bones, and teeth and mouth, and lead to other diseases. So, just to add, this slide shows that eating disorders often develop in the teen and young adult years, although they can develop at other ages. With treatment, you can return to healthier eating habits and sometimes reverse serious complications caused by the eating disorder. What are causes? There are mainly two: genetics and biology. Certain people may have genes that increase their risk of developing eating disorders. Biological factors such as changes in brain chemicals may play a role in eating disorders. Psychological and emotional health is also very important. People with eating disorders may have psychological and emotional problems that contribute to the disorder. They may have low self esteem, perfectionism, impulsive behavior, and troubled relationships. Other risk factors include family history. Eating disorders are significantly more likely to occur in people who have parents or siblings who've had an eating disorder. Other mental health disorders, people with an eating disorder often have a history of an anxiety disorder, depression, or obsessive compulsive disorder. Stress is also a very important factor. Whether it's heading off to college, moving, landing a new job, or a family or relationship issue, change can bring stress, which may increase your risk of an eating disorder. Another group of factors are dieting and starvation. Dieting is a risk factor for developing an eating disorder. Starvation affects the brain and influences mood changes, rigidity in thinking, anxiety, and reduction in appetite. There is strong evidence that many of the symptoms of an eating disorder are actually symptoms of starvation. Starvation and weight loss may change the way the brain works in vulnerable individuals, which may perpetuate restrictive eating behaviors and make it difficult to return to normal eating habits. First, we have to talk about anorexia nervosa, or simply called anorexia. It is a potentially life-threatening eating disorder characterized by an abnormally low body weight, intense fear of gaining weight, and a distorted perception of weight or shape. People with anorexia use extreme efforts to control their weight and shape, which often significantly interferes with their health and life activities. Do you know some pictures about anorexia in Google? Have you seen them?
Yes, doctor.
What do they look like?
Like very skeletic, like very thin people, tired.
Maybe I will try to show you some of these pictures. Do you mind?
No.
Maybe if we go to uh, Google, uh, okay, and maybe this is a very illustrative picture. Can you see it? No, of course. Mm. Let's see. What about this picture? Is it terrifying?
It
It
yes.
looks like a skeleton.
Okay. And there is another very important picture. Maybe it is very, very good to know it. Just a second. This is a very important picture. Can you see it? What about the mirror?
Like this kind of people, they think that they are fat, but they are not actually in the reality.
Okay. This is a very strong distortion in perception of their own bodies first, and in thinking. They think and perceive that they are fat, but they are not fat. They're either normal or a little bit uh, low weight people. Do you understand what I mean? Excuse me, colleagues.
Yes,
Yes.
Professor. Yes.
This is a very good illustration of mental, psychic component of anorexia nervosa. So go let's go on. Just a second. And so abnormal low body weight, people with anorexia use extreme efforts to control their weight and shape, mainly by dieting, which often significantly interferes with their health and life activities. What are the symptoms? It's very interesting to know the symptoms of this disorder. Not eating enough food and overconscious of the physical appearance is the first sign of anorexia. Overconscious. The other symptoms include intense fear of gaining weight. Maybe binging and purging is more typical for bulimia, but abnormal blood counts, fatigue, insomnia, dizziness, or fainting, blush discoloration of the fingers are very, very typical symptoms. Hair that thins, breaks, or falls out. Okay, dry or yellowish skin, amenorrhea, constipation, intolerance of cold, irregular heart rhythms, low blood pressure, dehydration, osteoporosis, swelling of arms or legs. So, anemia is maybe the main complication. Heart problems such as mitral valve prolapse, abnormal heart rhythms, or heart failure. Bone loss, which increases the risk of fractures. In females, the absence of a period. In males, decreased testosterone, gastrointestinal problems, electrolyte abnormalities, kidney problems, sudden death. This is, I have to emphasize, life-threatening condition. What is the treatment? Maybe medication is the second line, but antidepressants are useful, especially in cases where depressive disorder is comorbid with anorexia. And this happens in about half of the cases or more. So therapy, psychotherapy, counseling to recognize underlying issues, helping them learn to cope with the condition while encouraging to successfully deal with associated emotion, self-care, nutritional care to restoration of weight, and implementation, supervision of a meal plan. Nutrition. Follow a healthy diet, foods to eat, foods rich in magnesium, like whole grains and soup, foods rich in zinc, like almonds, and foods to avoid are caffeinated beverages like tea and coffee, and of course, alcoholic drinks. So, bulimia. Bulimia nervosa is a serious, potentially life-threatening eating disorder. When you have bulimia, you have episodes of binging and purging that involve feeling of lack of control over eating. Many people with bulimia also restrict their eating during the day, often leads to more binge eating and purging. During these episodes, you typically eat a large amount of food in a short time, and then try to rid yourself of the extra calories in an unhealthy way because of guilt, shame, and an intense fear of weight. So, so they have forced vomiting and they exercise too much and they use laxatives in order to get rid of calories. Symptoms are binge eating, forceful vomiting, long-term fear of gaining weight, preoccupation with weight and body, a strong negative self-image, overuse of laxatives, use of supplements or herbs for weight loss, excessive exercises, stained teeth from stomach acid, calluses of the back or of the hands, withdraw from normal social activities. So, kidney failure due to dehydration is maybe one of the main complications. They can have also heart problems, dental problems due to acid, stomach acid, digestive issues or constipation, nutrition deficiencies, electrolyte or chemical imbalances. Treatment on the first place are antidepressants, which reduce certain symptoms, but they also help to control eating habits. Psychotherapy is very important. Behavioral therapy is first line treatment, so it is very important. Combination of medication and psychotherapy is the best one. Do you have questions, colleagues?
No,
Do you have questions? No? Everything is clear?
Yes, so far so good.
Yes, doctor.
Okay, binge eating disorder. When you have binge eating disorder, you regularly eat too much food, binge, and feel a lack of control over your eating. You may eat quickly or eat more food than intended, even when you are not hungry, and you may continue eating even long after you are uncomfortably full. After a binge, you may feel guilty, disgusted, or ashamed by your behavior and the amount of food eaten. But you don't try to compensate for this behavior with exercise, excessive exercise, or purging, as someone with bulimia or anorexia might. Embarrassment can lead to eating alone to hide uh, your binging, and a new round of binging usually occurs at least once a week. You may be normal weight, overweight, or obese. It's more common among teenagers and early 20s, though it can affect at any age. Risk factors include family history, dieting, and psychological issues such as low self-esteem, lack of confidence, and shyness, like personality features, of course. Medication, psychostimulants are a good choice. It's known to control the impulses of binge eating. Selective serotonin reuptake inhibitors, this is the main antidepressants group. They reduce symptoms of anxiety and depression. Anticonvulsants and mood stabilizers control episodes of binge eating. And of course, cognitive behavioral therapy and dialectical behavioral therapy. Is it clear, colleagues, what are the main lines of treatment? Is it clear?
Yes.
Thank you. Rumination disorder is repeatedly and persistently regurgitating food after eating, but it is not due to a medical condition or another eating disorder, such as anorexia or bulimia, or binge eating disorder. Food is brought back up into the mouth without nausea or gagging. And regurgitation may not be intentional. Sometimes it is regurgitated food is rechewed and reswallowed or spit out. The disorder may result in malnutrition if the food is spit out or if the person eats significantly less to prevent the behavior. The occurrence of rumination disorder may be more common in infancy or in people who have an intellectual disability. Treatment, first line treatment is the medication baclofen, which is prescribed to people with rumination disorder who are not helped by behavioral intervention. But CBT might be enough for most of the cases. Cognitive behavioral therapy, psychotherapy, and they use alternative self-shooting practices, relaxation techniques, aversion training, sensory distractions after meals, exposure therapy to stimuli associated with regurgitation. Breathing training is very important. Training in diaphragmatic breathing is the core of rumination disorder treatment. Is it clear what is rumination disorder, colleagues?
Yes.
Avoidant or restrictive food intake disorder. This disorder is characterized by failing to meet your minimum daily nutrition requirements because you don't have an interest in eating. You avoid food with certain sensory characteristics, such as color, texture, smell, or taste. Or you're concerned about the consequences of eating, such as fear of choking. Food is not avoided because of fear of gaining weight. There are other reasons of fear, not gaining weight. The disorder can result in significant weight loss or failure to gain weight in childhood, as well as nutritional deficiencies can cause health problems. This is a kind of malnutrition. Symptoms include recurrent episodes of binge eating that lead to feelings of extreme embarrassment, eating large amounts of food in a short period of time, feelings of lack control of the situation, extreme distress about binge eating, poor self-image, and so on. Treatment, also cognitive behavioral therapy is very important, exposure therapy, group therapy, family therapy, many kinds of psychotherapy. Medical stabilization is second line treatment, and of course, nutrition counseling. we have to treat not only ARFID, but also co-occurring disorders like anxiety and depression. This is all for today. Do you have questions?
No,
Excuse me.
Professor, thank you.
Have a nice day.
Have a nice day.
Bye.
Bye.
Thank you, Professor. Bye.
Professor.